forensic medical exam. What we're trying to do, instead of them having to spend a whole day with this, is to bring the services to their community.
Okay, so you're bringing the actual unit out to them?
Absolutely, yes.
Now, tell us a little bit more about the unit.
The unit is equipped to where we can do a full forensic interview in the unit. We can also do a forensic medical exam. And as I show you the unit, you'll be able to see the equipment that we have and be able to understand kind of how we do it.
Okay, well, let's go ahead and inside and do that right now. And Russ, when we're walking in here, what are we looking at?
We're looking at the interview room, the welcome area, kind of a area for the children to be interviewed, obviously, and then this is an area where we talk to the either parent or the caregiver of the child, get information, put it into the computer. We're equipped with satellite telephone, digital equipment, so we can do internet, and we can actually do a hospital chart from here.
How do actually people find out that you are in town?
The professionals who use us are the ones that make arrangements for any kind of exams or any kind of interviews. Okay. So the way the process is handled is the professionals will contact us and make arrangements. We will then go to the area where they need us and do the forensic interview and the forensic medical exam.
Okay, now our cameraman Mark is back there in the operating. What is back there in that room?
That room has the medical equipment, the equipment necessary to do a medical exam on the children. The first room that we walked into in here has to do with the interviews.
Okay.
All interviews that we do are videotaped. So we're going to make sure that we preserve the evidence the best we can, that everything's done correctly. So we videotape all the interviews, and then we will come back here afterwards or after the interview, and they'll get set up for a medical exam.
Do a lot of children fall through the cracks out in rural Arizona?
I would say in all of Arizona, as well as a good portion of the country, many children do fall through the cracks.
Now,
obviously, the state is working very hard to try to come up with different ideas. This is one of a very good idea. We're helped by Arizona Foundation for Women, State of Arizona, Aetna, and many groups to help make this possible.
Well, CPS just got a little bit more money in the special session. Will that affect out in rural areas so much or not?
I feel it will affect the rural areas, the CPS money. What we're doing is a little bit different than what CPS is doing. The evidence collection will help CPS, but it's going to basically help the prosecution, help the FBI, the U.S. Attorney, etc.
Okay, Russ Hubert, thank you very much for bringing this unit in, and we'll look forward out in rural Arizona. Right now, if you need more information about the different kinds of child abuse and for more information about the Children's Mobile Advocacy Unit, go to azcentral.com and then click on links mentioned on 12 News.